Hello everyone, in this video we'll be discussing about temporomandibular joint. Before we start with the topic, make sure you subscribe this channel. So we will discuss this topic under the following headings. So let's get started. So temporomandibular joint is a joint formed by articulation of the mandible and the temporal bone of the cranium. It is a synovial type of joint present between two bones which is surrounded by a capsule filled with synovial fluid. Now we will discuss about few components of TMJ. The articular surface consists of two surfaces, the upper and the lower surface. Upper surface comprises of the articular tubercle and the mandibular fossa, while the lower surface consists of head of mandible. Another important component of TMJ are its ligaments, which are the articular capsule, temporomandibular ligament, phenomandibular ligament, and the stylomandibular ligament. The spheno and the stylomandibular ligament are the accessory ligaments. Now let's discuss about the attachments of these ligaments. The articular capsule or the fibrous capsule extends from the articular tubercle and mandibular fossa from the above and below to the head of mandible. The temporomandibular ligament attaches to the articular tubercle above and below to the posterolateral aspect of the head of mandible. The sphenomandibular ligament attaches to the spine of sphenoid in the above and below to the lingula of mandibular foramen. The stylomandibular ligament extends from the styloid process to the angle and posterior border of angle of mandible. Another important component is the articular disc of TMJ, which is an oval fibrocartilage which is peripherally attached to the fibrous capsule. It is divided into two surfaces, the upper concavo-convex surface and the lower concave surface. This articular disc is attached anteriorly to the lateral pterygoid muscle and posteriorly it is divided into upper and lower lamellae. Now let's move on to its relations. Towards its anterior lies the lateral pterygoid muscle, temporalis, and the masseteric vessels and nerves. Towards its posterior we have the parotid gland, superior temporal vessels, auricular temporal nerve, and the external acoustic meatus. The temporomandibular joint is bounded laterally by skin, parotid gland, and the temporal branch of facial nerve. Towards its medial lies the lateral pterygoid, auricular temporal nerve, spine of sphenoid, and the sphenomandibular ligament. Above the temporomandibular joint lies the floor of middle cranial fossa. Moving on to the blood supply, this TMJ is supplied by the superficial temporal artery and the maxillary artery and is drained by the superficial temporal vein and the maxillary vein. Its lymphatic drainage is via preauricular lymph node and the upper deep cervical lymph nodes. The nerve supply of TMJ is via auricular temporal nerve and the masseteric nerve. Its applied aspect includes forward dislocation of the condyle of mandible. This stretches the ligaments and muscles which causes severe pain. Moving on to the last topic, the temporomandibular joint allows variety of movements which are the elevation or opening the mouth, depression or closing the mouth, retraction or moving the mandible backwards, and protrusion, that is moving the mandible forward. Further information are already discussed in the video of muscles of mastication. So that's it. Make sure you subscribe my channel. See you in the next video.